Two. Mayor Scott, thank you so much for joining us today.
Thank you for having me, Dr. Kaye.
So I want to get right into our conversation because there's a lot happening in the city. I know people have questions. Can you first talk about the reasoning behind the mandate? Of course, you knew I was going there first. Mandating high school athletes as of November 1st to be vaccinated to play winter sports, which at some point might be spring sports as well.
Yeah, thank you. This is a decision that Dr. St. Elisa's and the school board have taken really to protect our student athletes and their staff and teachers. We know when you're talking about high school students who are going to be participating in those sports, not just here, but really around the state, they're going to be traveling and doing that. You have to figure out the best ways to protect them. We know because of the intimacy, and I know better than anyone else, the intimacy of a high school sports team, how quickly things can spread. We know that colds used to spread quickly throughout the Maryville track team because we spent so much time together. And I think it's an important step because when you think about high school athletes and you think about these young women and young men who a lot of them are going to be banking on, Dr. Kaye, their ability as an athlete to help them go to the next level in education on the college, you have to do everything you can to preserve that and to preserve their health and safety. It's not uncommon. We know that city school students, I know I had to have vaccinations to be a part and be a student in Baltimore City schools. We know that there are things that you have to fill out in forms to even participate in athletics. And I think this is a why controversial one. I think it's the right decision for our student athletes because we're talking about protecting them, their families, really about their future, and of course the teachers and staff, their coaches that work with them.
So now what I'm trying to reconcile is like, okay, so I have my 10th grader at Poly who's playing football and who has dreams of playing in college. You have to go get vaccinated, but you have a professional football player, Lamar, who's had COVID twice, who can make that decision. Like it feels like it's punitive for high school athletes, but $1 million, professionals can live their life, at least here in Baltimore City.
Well, I think I will look at it a little differently. I think that, one of your counterparts in the media said after asking me specifically about Lamar's situation, that it seems like that I'm Lamar's agent, right? Because his decision, and we can look at others, and we know the NFL, look at Cam Newton, they can say what they want, but you better rest assured his decision and how he has treated COVID-19 and those protocols impacted the way that the Patriots made their decision. And we're talking about with players losing time, they're going to lose money, right? They're going to have to, we're talking about millions of dollars of loss. If Lamar loses time due to COVID, those are millions of dollars this year. And be very clear that we're talking about probably tens of millions of dollars or what we're all expecting to be an historical contract. So we have to think about it like that. The NFL is very strict on how they're treating those athletes. COVID non-vaccinated athletes are being treated very differently, and they're making it very difficult for them to not get vaccinated, especially from a financial standpoint.
I'm glad you said that because we want to be able to reconcile and have it make sense when we tell an 11th grader, look, you got to do this. We want it to make sense. That doesn't feel like you're being punished.
And I think, Dr. Kaye, it's also important to know, like, it's not just going to be that sport, right? When you look at the NBA, for example, if you're living in New York, right? If you're living in New York or San Francisco, right, you're going to have to be vaccinated. So that means people like Kyrie Irving's going to have a decision to make. Kevin Durant's going to have a decision to make. Steph Curry is going to have a decision to make. And we're going to put people in a very particular situation when you're talking about 20, tens of millions of dollars. Are you willing to set that aside? Because you think about an NBA season, it's 70, or maybe they go back to 82 game season. So you're talking about 40 game checks if you don't get vaccinated. I don't think folks are going to be willing to risk that. Folks are going to get vaccinated, do the right thing, and play.
I'm glad you said it that way. So what about for Baltimore City employees? So we're now moving into that. So can you talk a little bit about where we stand at this moment in terms of the requirement for people working for Baltimore City?
Yeah, we announced yesterday that earlier this week that I am moving us towards a mandatory vaccination or weekly testing regimen like the school system have, like many governments have around the state and around the country. And it's about making sure that we are leading, right? We know that our health department, our health commissioner, Dr. Jaraza, has been leading. We know that our city has the lowest positivity rate in the state right now, even though it's a significant increase for us, Dr. Kaye. But we now have to continue to take the next step. We need more people to get vaccinated if we want this to end, right? I know folks have a lot of questions and concern. We want to get them answered. This is why we're going door to door. This is why we're going into communities with the vaccination. This is why we're using credible messengers. But we know, as the great Sean Carter always said, women lie, men lie, numbers don't. The numbers will tell you the people that are in the hospital that are dying are unvaccinated. We know folks are saying, well, unvaccinated people are still getting COVID. Yes, but they're getting it from unvaccinated people. And guess what? They're not the ones on ventilators. They're not the ones having to be in the hospital. We have to understand, we have to put down these quick talking point dog whistles to understand that nothing, you can get the flu if you get the flu shot. You can get chicken pox if you get like polio. It's still a possibility. Nothing is 100% 100% effective. You know, birth control, for example, none of it is 100% effective. And we have to make sure that we're doing the right thing, and getting people vaccinated is the right thing to do. So we're going to be working with our employees to get more and more of them vaccinated as we move towards how we can be responsible to help us in this pandemic.
So I have a few more questions for you. And again, thank you for your time. So we had Baltimore City featured on CBS Sunday Morning. Shots fired, which I have a lot of problems with the name and the framing of that, by the way, a lot of concerns about that. But one of the things that came out is the ways in which Baltimore City is doing something different by putting activists and faith leaders in the streets, making sure city council people, I'm thinking about the work that Zeke Cohen is doing, and saying that in dealing with homicide, it's not just about getting guns off the street. We're talking about a more holistic approach. How is that rolling out? Because I know you were very strong on putting that forward as a plan. How is it working?
Yeah, listen, we know that it's working. You saw the great brothers from Safe Streets and others. I was up in my old neck of the woods in Park Heights with the brothers from We Are Us on Monday. We know, and that's the way that we're leading. You know, I had another mayor in town from New York, in Mount Vernon, New York today, talking to me specifically about how we are moving towards our reimagining of public safety. And we know, Dr. Kaye, that while we still have this epidemic of gun violence, we know that the same old is not going to work. And we're rolling these things out. You're going to hear a lot more from me in the coming weeks about how specific investments and changes and things that we're going to be doing. But we know this way will work, right? We know that going out with those credible messages. We know that dealing with trauma, we know that helping people resolve their conflict in a different way early on will help us to reduce violence. And we also know that getting guns off the street, it's not an either or, it's a doing both, and not just saying that there's one end all be all solution, because there isn't.
Because it's complicated. And
it's very complicated. And when you think about some of the incidents that we've had, you know, just this year, right? When you think about the tragedy with those young brother and sister, like think about things like that we've had. When you think about the simple beefs where people are dying over Instagram, or people like that kind of stuff, means that we have to dig deeper. That it's not just that some police officer or some city employee is going to immediately be able to intervene, and that as it's happening, we have to deal with it on the front end as well.
And so finally, I just want to ask you, Mayor Scott, this does not fall under your purview, although I would argue that as the mayor, everything falls under you, even if you can't directly change it, right? So we hear a big complaint going, why can't Mayor Scott give us HVAC systems in the school? Why is he not making sure that the babies have what they need? Can you explain again why it is that you just can't take the $700 million you have and make sure that we have a new HVAC system? Because that is a confusion for people.
Yeah, it is confusion, because folks see Baltimore City Schools and they think like the city is in control of it, right? The same way you think with the police department, or, you know, they think that the mayor's control of MTA, or, you know, we have to explain to folks the separation of powers and how government works, and we have to continue to do a better job of that. But with this issue in particular, Dr. Kaye, I think this is a misunderstanding that shouldn't be a disproportion, right? Because first and foremost, let's call a spade a spade. I went to Baltimore City Public Schools from 1989 to 2002. It wasn't until the fall of 1998 when I started my freshman year at Mervo that I had an air conditioning class. So this is not a new thing that has happened in Baltimore City. That conversation has really been about like over the last 10 years. But when you think about Baltimore and school renovation and construction and air conditioning, these are the things that are missing. And this is the conversation that I tried to have with some of your media counterparts over the last couple of weeks, right? So to talk about the air conditioning thing first, yesterday we had the governor and the comptroller, put on a show at the Board of Public Works. And the thing that makes me upset is that we had the state treasurer say, hold on, you guys, let's talk about the facts. The facts are, and these are the facts for your listeners. In 2018, there were 75 schools in the school system that didn't have air conditioning. That number is now down to 21 in just, less than 3 years, right? 3-year period. That's a significant progress. But also, Dr. Kaye, there was a plan developed by the school system, approved by the very Board of Public Works that the governor and the comptroller used to bash the school system's inability to get air conditioning in the school. They approved the plan. So that plan is there. The money is already allocated, but folks have to also understand how capital projects work. For example, there's a brand new, wonderful building built on the campus of Morgan State University. That building, that money was not allocated last year or the last 2 years when that was being built. That's not how capital projects work. They work over a period of time. The school system has this plan. The plan has been approved by everybody, including those 2 elected officials. But also, I think it's important for people to know this. We as a city have to stop allowing folks who like to just come in and leave after they dumped on us to try to control the narrative, right? Because what we really should have been talking about, and this is what I tried to get folks in the media to talk about a little bit more, some did, is that, Dr. Kaye, we opened 5 brand new schools in Baltimore City Public Schools,
right?
Come the 21st century schools on the first day of school this year. That's a record for us. We've built over the period of this 21st century program or renovated 28 new schools on budget or under, not over, right? And to the point where now the entire state school construction and renovation program is based on what jurisdiction? Baltimore cities. So that also has to be talked about. We have to make sure that we get our babies the air conditioning, but it's much deeper than that, because at City College, for example, you can't just go into a castle that was built hundreds of years ago and plug air conditioning units up into the wall, because the electrical system has to be done. That's why you have to do it in a complete renovation, which is the plan. We have the plan. We want folks to follow it. We're going to make sure that we're meeting those goals and handling appropriately, but we're also not going to allow folks to break out the dog whistle just because they feel like, oh yeah, well, I'm under pressure now, so I'm just going to blame someone else when we have a plan that they approved.
I appreciate that. I've heard the responses around that, which is why I wanted to give you an opportunity to flush it out so that people will understand exactly what's going on. As always, Mayor Brandon Scott, I appreciate our monthly check-ins. Thank you so much for joining us.
Thank you, Dr. Kaye.